All right, everyone, thank you so much for joining our webinar. We're going to be talking about the 2023 ICD-10-CM updates. It's one of my favorite topics to present every year. Basically, we're going to talk about the updates, what you need to have on your radar in terms of codes, code changes, guidelines, documentation, updates. We'll talk about the people, the processes that are going to be affected by these changes, and so on. So we'll talk about the major updates. We'll talk about some of the code additions, deletions, and revisions. We'll talk about the guideline updates, changes, and then we'll get into some of the roles and workflows that may be impacted by the 2023 ICD-10-CM updates. So first and foremost, you want to make sure that you've got the latest and greatest ICD-10-CM guidelines. So we've got 1,176 new codes, lots and lots of changes for 2023. We've got 251 deleted codes, 36 codes that were converted to parent codes, and then we have significant guideline updates. So the transition from the fee-for-service payment methodology to value-based care is continuing to drive many of our coding changes. So as far as our chapters, we still have our same chapters, chapter A through Z, and then we had a brand new chapter added, I believe in 2021, chapter U, which is our codes for special purposes. So in terms of our guideline updates, we saw a lot of changes to guidelines, changes to what can be added to the list of exceptions requiring provider documentation versus non-provider documentation and how that can be captured. The under immunization status. So basically what's happened is this has been an exception that's added to the list of codes that can be reported. We also have updated language to the guideline documentation of complications of care. We also have updated guidelines for selection and sequencing of HIV codes. We also have an update and change to admission and or encounter for treatment of primary site for malignancy. We also have a brand new guideline for secondary malignant neoplasm of lymphoid tissue. We also have a brand new code for long-term use of injectable non-insulin anti-diabetic drugs. For dementia, so dementia completely exploded in 2023. We also have a new code for completed weeks of gestation. We also have a new guideline for hemorrhage following elective abortion. We also have an updated code for encounter for pediatric to adult transition counseling. We also have an update as far as language to the social determinants of health guidelines. So the major changes, not all inclusive, but the major changes are going to pertain to candidiasis, hemolytic uremic syndrome, lots of expansion to von Willebrand disease, thrombocytopenia. We have a lot of new codes for short stature, acidosis, lots and lots and lots of new codes for dementia. Also a lot of new codes for endometriosis, aneurysm, site specificity, muscle wasting, epiphysis. So now we'll kind of dive into some of the specific code changes. So with von Willebrand's disease, we've got unspecified, we've got type 1, type 2A, type 2B, non-immune heparin-induced thrombocytopenia, and then we have a lot of new codes for short stature. With dementia, we have so much going on with dementia. We've got 87 new codes just for dementia. Then we have some changes to muscular dystrophy. We also have separate codes for refractory angina pectoris. We have new codes for intervertebral annulus fibrosis defect. We also have a lot of new codes for epiphysis. We also have pretty significant expansion to endometriosis. We also have a lot of new codes for maternal care. We also have additional specificity for sleep apnea of newborns. We also have additional codes for social determinants of health, risk adjustment, population health, looking at predictive modeling, looking at the value-based care model. So who is impacted by these code changes? Well, there's many folks that are involved. So similarly to the folks that are impacted, the workflows that are impacted. So some best practice tips as we wrap up. As with anything, you want to make sure you're auditing internally and externally. Some resources that were used. So I want to thank you so much for your time and attention today. Really appreciate it. I hope that you have enjoyed the material. Thank you so much and have a great rest of your day.